Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and today we have a very special guest. Dr. Barry Glassman is highly renowned. He's a diplomat of the Board of Academy of Craniofacial Pain, the Board of Academy of Dental Sleep Medicine, Academy of Pain Management, and the list goes on and on. A fellow of Dentistry International, American Headache Society, American Pain Society. Dr. Barry Glassman, let me tell you, I heard Dr. Barry Glassman on a show I'm a big fan of, the Dental Hacks, and the value that was brought to that podcast, it was just so captivating. We're going to talk about some things that kind of go outside of what we normally talk about. We talk a lot about SEO. We talk a lot about web design and photography and video and things like this, marketing. But I really want to talk about, how to help you build the practice that you want. And Dr. Glassman is really, really a good example of someone who transformed his career to be much, much better fit for what he wanted. So without further ado, Dr. Glassman, how are you?
How are you, Justin? Good to hear from you.
I'm doing great. Maybe you could kind of jump into the story of how you got into dentistry, some of the changes that you made to build the practice that you really want.
Yes, I could, but I think that when we started this and I asked Justin, I said, how long do we have to speak, and try to keep this at a 20-minute or so session, in order to make it, Justin, as useful as possible to anyone who's listening. I would answer that question a little bit differently, and I would say to you, Barry, since you're old and decrepit, and you have maybe some words of wisdom for the younger generation or the younger people that are in this profession that you have so much empathy for, because the world has changed so dramatically, and things can't be done the way they did when you graduated, Barry. And there are so much more, and things are so much more complicated, and the world is so much more complicated, and the people that we are treating are so much complicated. It's really hard to ask advice of someone who, when they graduated, we were limited to a half-inch sign outside of our office with our name on it. That's the sign up. To this day, that's the sign that's still in front of my office. It says Dr. Barry Glassman, and it's a half inch in height, because legally that's all we were allowed. There were no fictitious practice names. It was a different world, and yet I do think, Justin, that there are those of us who have really some good information for our profession. And what I have noted is that the truth of the matter is the question is actually brilliant. Why did you become a dentist? What chose you? And then how did you make the practice what you wanted to make it? Which is really an interesting premise, because what the premise says is that maybe dentistry itself wasn't enough. Maybe there's something more specific about dentistry that each of us find ourselves needing to find. Dentistry is different than so many of the other professions, Justin, because you know that, one, nobody knows what a dentist does when they choose to be a dentist. Nobody knows what their day is like. They only have experienced what they've experienced. When I chose to be a dentist, I went because Dr. Green seemed like a really nice guy. And even though he hurt me with those big needles, and even though I watched that frayed handpiece, or the electric handpiece going around with, even though with fear, I still became a dentist, which makes you wonder about me. But what I'm saying is, we don't know what it is. And then we spend 4 years and today hundreds of thousands of dollars to become a dentist. And now we're faced with finding out how very complicated all of the things are. Getting patients I don't have to go through the things all your people already know. And how do you deal with that? And how do you make that all work? And then at the same time, in our hearts, we all became dentists because we wanted to do good service. So how do we then continue to do a good service while facing all of these economic pressures and demands and dealing with all the problems we're dealing with, all the hormones in our office and all of the issues that we all deal with, and the higher levels of patient expectations? It's really difficult. And what I'm finding, and I'll ask you a question. If I were to ask you, dealing with the dental practice, if I were to ask you, dealing with the dentist that you deal with, what percentage of dentists that you deal with do you believe are really happy in their profession?
That's a really good question. In terms of revenues, I think few. In terms of lifestyle, I think most of my clients really enjoy most aspects of what they do. However, that kind of depends, because it's like an onion, as you get deeper and as the relationship starts to form, I start to find out more things like, oh, I'm not happy with my staff. I'm not happy with this. I'm not happy with that. And so on the surface, it looks like everyone's happy, but not as you get deeper, it looks like there's a lot of problems in the practice.
If I could yell bingo real loud, will it upset everybody? I can't tell you how many people tell me how wonderful our profession is. Isn't it great? You have a decent income, you get to help people, and you have control of your life, and you can take your vacations when you want, and all that. And then at the end of a 2-day course, on a first day when we go out for dinner and we have had the second drink, and you're listening to the GD staff and the GD patients, and can you believe this guy came in and he wanted this, and how am I supposed to? And you want to say, well, what happened to the love? Where's all that happiness? So what you've noted, which is an incredible answer, which gives me a real good clue about who you are and how you're dealing with your people, which is a positive thing. Just what you've noted is that it's not that it's maybe more common that if that onion gets peeled underneath, you get to see some of the dissatisfaction and some of the concerns. And here's the problem. That onion doesn't only keep the facts and the truth from you. In order to succeed, in many cases, that onion needs to keep the facts and the truth from them. And so we develop these mechanisms to deal with our frustration and cover. And we are not the people, in many cases, the husbands or the wives that we were when we married, or the father to the children that we'd like to be, or the people internally that we'd like to be, because of there's one major cause, and the major cause is the experience that we've all experienced to get where we are. It's called dental school. And dental school teaches us inadvertently, but very, very specifically, about the word perfection. We're supposed to be perfect in what we do. And we all know that we're not. But how we handle that lack of perfection and how we deal with it internally certainly adds to our degree of unhappiness. So if someone were to say to me, what's the best thing you could do for your profession? And I would say I would eliminate that word, and I would work with my profession so that they understood that our goal is to do the best that we can under the circumstances, and that the guy down the street is struggling with difficult procedures the same way you are.
That's That's really interesting. And so you actually have a website called glassmanseminars.com. Can you tell us a little bit about how you help dentists in this respect?
Okay. Well, I teach courses in sleep, for those that are interested in sleep apnea and adding that aspect. And I teach courses in occlusion and what people would call TMD, though I avoid the term with a passion. And we teach courses because there's so much in dentistry that people are taught that just isn't so. People need to have good bites, otherwise they won't be healthy. Wrong. Bites have to be class 1 to be healthy or normal. Wrong. People with high bites will get, or you leave a filling high and people will get a pterygoid spasm and it will create joint pain and joint problems. Wrong. There's a series of things that handcuff dentistry because we're told that they're true, and then we experience something that looks like truth, and we get what's called confirmation bias, and it really ties us up and makes our lives much more difficult than it has to be. So we teach courses in occlusion that's very, very different than if they were to take a Pankey course or a Spear, and nothing wrong with those people. They're fabulous restorative dentists. They just teach some things about joints and muscles that aren't accurate and that really do affect everyday dentistry. So we teach that. I've done some courses in burnout. I consult with patients, with dentists privately who are unhappy or reach out to me for some help because I have great concerns for them. And the website is, kind of sucks. It's not a fabulous site. It's not meant to be. It lists my courses. That's all it does. I'm kind of jealous because before I got on the phone call with you, I had to look up what SEO meant, and I'm not in. Marketing was never something I was. I understand the need, and I'm not judgmental. It's just us old guys aren't necessarily as comfortable with all that, and I don't have any problem with people marketing at all. I have problems with people claiming to do services that they're not yet ready to do or not capable of. And therein lies my problem. So as a marketer, you have to turn to the people that you're working with and say, okay, not what do you want to do? What can you do? What services can you provide comfortably that we can then lean and reach these people that need these services? How do we do that best for you? Not how can we expand your services, because as a marketer, Justin, you can't expand their services. That you can get. Yes. So I got a lot of people putting in oral appliances for sleep that have no idea what they're doing. I have dentists claiming to be cosmetic dentists, and I never understood that term. I always guess that made me an ugly dentist. I mean, So I so want our dentists to get good at what they do. And then if they then market the hell out of it, let everybody know that, and provide a good service. Wow, now we've done something positive. And we've always believed that the bottom line will come if you do good services. The patients will come, and I would like to see that included in the marketing concept somewhere.
Mm-hmm.
That it's not enough just to bring people in, and you really have to do the services well. I'm not suggesting that people aren't doing the services well. I am suggesting that we get handcuffed a lot by dental myths, and that the economics of the world has created this situation where people feel the need to expand, maybe before they are physically ready, and it hurts both the patient and the dentist if they're not ready for that.
How important do you think it is to, I know you focused on sleep dentistry, how important is it to find your niche, to find that service that you can provide confidently?
You know, that's great. I became a dentist, and I think that going to dental school was probably the number one mistake I made in my life. The number one. Unbeknownst to me, I didn't know that I wasn't going to actually love everyday dentistry. And I joined a very high-level prosthodontic practice with our own lab, where we did our own castings and double castings and major dentistry. And I was okay. I wasn't a bad dentist. I was a pretty good dentist. The pressures on me were massive. And what I did to protect myself from those pressures was incredible steps that I didn't recognize at the time. An opportunity came along for me to step out into pain management, and I took an incredibly torturous path from all the dentists, all the gurus who taught that, from Niles Gaucher to Harold Gelb and Bruce and Jankelson in neuromuscular dentistry. I mean, it's massive, the incredibly torturous path I took. My goal is to teach people pain management that are interested, and eliminate that torturous path, because it wasn't necessary. But it was, when I look back on it, what an incredible path I took. How important was it for me to find just what you said, to be able to do what I thought the aspect of the profession, to find something that I felt comfortable with. An amazing amount of people aren't comfortable with general dentistry and have built the same protective mechanisms that I was building. So I'm going to eventually eliminate doing root canals on molars because I don't like them, or etc. People do all kinds of things in order to find their comfort zone. I'd say the following. There's a book that I recommend to all my dentists. It's called The Four Agreements by Miguel Ruiz. And the Four Agreements he's a surgeon, and it's a long story, and we really don't have the time for it, but the Four Agreements are four agreements that we as humans make with our world. And if we follow them, we increase our likelihood of happiness. And the first agreement is to be impeccable with your word, or be honest. And in order to be honest with your world, here's the problem. You have to be honest with yourself. And if you're not happy doing what you're doing, seeing more people and making more money won't make you happier.
Right.
So you've got, and so I'm not blowing smoke. I'm really impressed with you making the realization that it's not just about being on the first page on Google, or see, I did look up SEO. You can't fool me. It's not about being on the first page, or it's not about simply controlling your costs, or making money. I went to a meeting of the group dentists, the national group group dentistry, and I thought it was going to be the big guys, like all these new groups that are, but it's not. These are people who are taught how to become entrepreneurs and own practices and really make their money through hygiene, and then expand, and to be open on Saturdays and Sundays and Christmas and New Year's. And I mean, I kid you not. And I'm sitting there watching these 400 dentists in this meeting, and I wasn't sure if I was in a dental meeting or an Amway meeting. And I'm thinking, this is so. It's not why we went into this profession. It's yeah, you can go this route if you want, but the bulk of the people that you're working with want to become good dentists, and as a result, be paid for that. So, so one is to be impeccable with your word. Two is not to take anything personally, which is really hard because we're taught as dentists that we're responsible for everything. If a patient has pain after we do a procedure, obviously we did something wrong. Well, obviously we didn't necessarily do something wrong, but the world assumes we did, and our training assumes we did. That, you know, if this was done better, that patient wouldn't be in pain. No, some people have higher pain thresholds or lower pain thresholds, and either central nervous system or peripheral sensitization issues that have pain after normal procedures are well done. So if we don't understand that, yeah, we start to beat ourselves up, and we're unhappy. And it goes on, not to make assumptions. And finally, the last one is to do your best. So it's not as though you don't care. Of course you care. When it says don't take things personally, it means don't take things that you're not responsible for personally. And it's hard when a patient's screaming at you about the last visit. It's very hard. So we teach people how to deal with that and how to do that, and to give them the chance to be happier so that they can take advantage of your services and get more people in and do better economically while truly enjoying their practice. Right.
Well, that's very well said. It's such a huge honor to have you on, Dr. Glassman.
My pleasure.
This is amazing because this is stuff that a lot of people aren't talking about, you know, and I think there's a few dental shows out there, and I'll tell you, man, you stand out when you're a guest on a show. I'm looking at that episode in a whole new way. So thank you very much.
I really, really appreciate that. My hope is, I really do. I've given up a long time ago. I had some really high ideals on what I wanted to accomplish for my profession, and it's not so easy. And I've given up on them. I have, I'm not going to have the influence that I thought someday that I might. But that doesn't mean that I can't have the influence with a higher level of influence for fewer people. And if I can help make some people happier doing better services, that means that their patients benefit as well. That's where my emphasis is for now. Thank you, Justin.
Thank you. And where can the viewers and the listeners find you?
Well, I live here in Allentown. Do you want directions? See, old people, you say that to. It's my email would be Dr. B Glass, DRB Glass, not Glassman, DRB Glass @gmail.com. I answer them if there is anything. Any questions people have, or study groups, or or lecture situations that they'd be interested in, and of course you can, as you said, my website is glassmanseminars.com. I'm also doing a course got upcoming courses in Toronto, a 2-day course on TMD, quote unquote, pain and dysfunction. They had a 3-day course in September in Sarasota. I teach with Howard Chaslin, who's a prosthodontist. He's excellent course. And I'm in London, and a sleep course here in Allentown in October. So all that's on that website.
Excellent. Well, thank you. It's been hugely valuable. It's been an honor to have you on. And guys, if you have any questions, you know where to find them. Yeah, and you know where to find this episode, the Dental Marketing Guy blog. You got the Dental Marketing Guy show on YouTube as well. And guys, hit me up in the comments below. If you have questions for Dr. Glassman, if you just put them in the comments below. If you're watching this episode on Dental Town, on my blog, wherever it is that you find it on social media and whatnot, just feel free to reach out. So thank you for watching the Dental Marketing Guy show.